So let's begin. So we are here for the MCQ discussion. So we have 25 MCQs, that is randomly MCQs I will be discussing. So I know this is I am doing for the second time actually MCQ discussion. So let's begin with it. Hello Arsula. Okay, let's begin. So the first MCQ, it's a simple one. What is the most common type of tracheoesophageal fistula? So anyone, first is esophageal atresia with proximal TEF, esophageal atresia with distal TEF, H type esophageal fistula, and pure esophageal atresia. So what is the most common tracheoesophageal fistula? So anyone if you can answer. Okay. Okay, the most common type of tracheoesophageal fistula. Hello. Most common type of esophageal fistula is esophageal atresia with distal TEF. So it's basically factual questions. So no need of any explanation right here. Then next question what we have, it's an interesting one. 45-year-old patient presents to the OPD with the complaints of painless bleeding during defecation. On examination, a pinkish mass appears at the anal orifice. When the patient is asked to strain, it reduces spontaneously when the patient relaxes. So what will be the grade of hemorrhoids? So basically the question here is, it is a case of hemorrhoids and patient age 45-year-olds, painless bleeding during defecation, pinkish mass appears on the anal orifice, and the patient is asked to strain and it reduces spontaneously on relaxation. So anyone request to join. So which grade is this? Year 13. Okay. So we are talking about here the hemorrhoid, second degree. Yeah, you are right, second degree. So I will tell you the grades now. See the first degree, what is it? First degree is bleeding will be there, no prolapse. Then second degree prolapse will be there with spontaneous reduction. And third degree prolapse will be required and manual reduction will be required. And then fourth is prolapse but cannot be reduced. So I repeat once again if you want. The first degree bleeding with no prolapse, second degree prolapse with spontaneous reduction, third degree prolapse requiring manual reduction, and fourth it is a prolapse but cannot be reduced. Okay. The next question what we are having is, what is the most frequent site of ectopic gastric mucosa? I repeat, what is the most frequent site of ectopic gastric mucosa? Options are upper esophagus, lower esophagus, pancreas, and Meckel's diverticulum. So anyone if you want to answer, most frequent site of ectopic gastric mucosa. So okay, the answer here is the most frequent site is upper esophagus. So it is the upper third of the esophagus where it is referred to as inlet patch. Meckel's is not there, sorry. It's the upper esophagus and it is mostly congenital and always asymptomatic. Occasionally it can release acid which can result in dysphagia esophagitis, Barrett's esophagus, or rarely adenocarcinoma. So the answer is upper third of esophagus. So next question. This can't be there. This is the image based question but I cannot, sorry. Next question. Okay. You are monitoring a number, duration and intensity of uterine contraction in a 34-year-old G2P1 woman with a term pregnancy. How long should they last for you to classify them as moderate? So basically G2P1, 34-year-old, and it's a term pregnancy. And how long should they last for you to classify them as moderate? 20 to 40 seconds, less than 10 seconds, 10 to 20 seconds, or 40 seconds, more than 40 seconds to classify them as moderate. So anyone wants to answer this? Okay. See, if you're telling that there is a moderate uterine contraction, it means it will be 20 to 40 seconds. 10 to 40, no, it's not 10 to 40. See, when it is less than 20 seconds, it means it's a weak, and moderate is 20 to 40, and strong is greater than 40. So during active labor, the uterine contractions are 5 minutes apart for 1 hour. That is greater than 12 contractions in 1 hour. This is accompanied by cervical dilatation of greater than 3 to 5 centimeters. So what is here you have to remember is weak is less than 10 to weak is less than 20, moderate 20 to 40, and greater than 40 is severe contractions. Then now patients come to you with fever, fatigue, malaise. Now investigations, what you reveal is anemia and thrombocytopenia. Thin blood smear is there. What is the recommended therapy for this condition? So I cannot show you the picture basically, but it's a pathological picture. Okay, just you remember it is a fever, fatigue and malaise. Investigations is anemia and thrombocytopenia. Then what is the recommended therapy for this condition? So you have the options here at clindamycin plus atovaquone, azithromycin plus atovaquone, azithromycin plus clindamycin plus quinine. So you have to guess the diagnosis here: fever, fatigue, malaise, anemia, and thrombocytopenia. That's it. I know it's difficult without the pathological picture, but okay. The pathological, what the picture shows here is it's a tetrad or the Maltese cross. Basically, diagnosis what they have given here is babesiosis, and what is the recommended therapy for babesiosis? And even recommended therapy for babesiosis is azithromycin plus atovaquone. See, what is babesiosis? You have to remember first. Babesiosis is basically it's a zoonotic infection which resembles malaria but is not malaria, and it presents with febrile illness, hemolysis and hemoglobinuria. Okay. So if you have a mild to moderate disease, what you will give? You will give azithromycin plus atovaquone, and for severe you will give azithromycin plus atovaquone plus clindamycin plus quinine. That is alternative therapy. See, it's not common question, but now next question, this one you will be able to answer. See, the question is, the patient comes with you with multiple sclerosis. Which of the following is used to determine the neurological impairment? Hassenham scale, revised McDonald's criteria, Kurt's expanded disability status scale, modified Wells scale. So if anyone wants to answer, what is question here is, in multiple sclerosis, which of the following is used to determine the neurological impairment? Hassenham scale, revised McDonald's criteria, Kurt's expanded disability status scale, or modified Wells scale? Anyone? Okay, if no one answers, see, the answer here is expanded disability status scale, which gives you a measure of neurological impairment in multiple sclerosis. So this is basically scoring system is there. In short, you can tell EDSS score. So in EDSS score, if it is less than 3.5, the patient walks normally, showing no disability. If it is more than 5.5, there is a progressive disease, gait impairment and occupational disability. Then if EDSS score is equal to 10, that is, there is a death due to multiple sclerosis. So the scale what we are using is expanded disability status scale for multiple sclerosis. I hope you understand that. So next the question is, what is the level ratio of ear ossicles? So the options here will be 14:1, 1.3:1, 18:1 and 22:1. So what is the level ratio of ear ossicles? Anyone wants to answer this? It's a factual question. No. Okay, the answer here is 1.3:1. The handle of Malleus is 1.3 times longer than the long process of the incus, providing a mechanical advantage of 1.3. So basically the level ratio of ear ossicle, Hindi Siddhiki. Okay, the level ratio of ear ossicle is 1.3:1. So again you can tell it is a factual question. No need of explanation. What is then we have? Which of the following is true about anandamide? See, anandamide, which of the following is true? It is not produced endogenously. It is a nociceptive agent. There are anandamide containing neurons in the periaqueductal tray. It binds to opioid receptor. Anyone knows what is anandamide first? Before going to this. Okay, see. The anandamide is basically it is containing neurons. Anandamide containing neurons in the periaqueductal tray and other areas concerned with pain. Basically, it's a part of the brain. It's concerned with. See, 18:1 is not the answer. It was 1.3:1. See, there are two types of endogenous cannabinoids. It's a cannabinoids. There are two types: 2-arachidonic glycerol and anandamide. They bind to CB1 and CB2 receptors. They have an anti-nociceptive effect. Basically, it's a part of brain and not part of brain control, but they are anandamide containing neurons in the periaqueductal tray. So there are small questions. First, see, the glucose transporter present in the erythrocytes is. It's a biochemistry question. The glucose transporter present in the erythrocytes is LUT1, LUT2, LUT3 and LUT4. So anyone wants to answer this simple question? Glucose transporter present in erythrocytes. What RBCs? So the answer is LUT1. Basically, you have to remember this. There is no choice, but if you want some explanation, I can give you. So basically, it mediates basic glucose uptake. LUT1 is also the major glucose transporter in the brain and placenta and is widely distributed. So you have to remember this. A glucose transporter present in erythrocytes is LUT1. Now a good question. See, a woman presents to the OPD with a painless lump in the left breast. Biopsy confirmed at the presence of ductal carcinoma. Okay, ductal carcinoma is there. Then immunohistochemistry, what you will do? We have shown it ER positive, PR positive, HER2/NEB negative. Which of the following is the latest drug approved for treating the condition? First, similar diagnosis. See, the condition showed painless lump in the left breast. Okay. Second, ER positive, PR positive, HER/NEU negative, and it is in ductal carcinoma. So first, anyone tell the diagnosis, then we will move forward. Anyone? So you can just tell it is a breast cancer that you have diagnosis confirmed is ductal carcinoma. They have already said, but the newer drug what we use here is palbociclib. The options, what are the options? A, Herceptin, palbociclib, bupalisib, ipatasertib. So the answer basically here is palbociclib, but it is a newer drug approved for metastatic hormone receptor positive. I told you that HER is positive. ER positive is there. For metastatic hormone receptor positive HER2/NEU negative breast cancer. This is basically recent updates you can tell. Image-based questions are there. Okay. Now a simple question. Isosorbent dinitrate. It is indicated for congestive heart failure in combination with which of the following vasodilators? It's very simple. I think everyone can answer this. Isosorbent dinitrate indicated for congestive heart failure in combination with which of the following vasodilators? First, minoxidil, hydrogen, nomodipine, nintedanib. So this anyone will answer. Can anyone tell? Isotropin is indicated for congestive heart failure in combination with which of the following vasodilators? CCB. CCB is not there. See, the answer it is hydrolazine. It is there is a combination for CHF. Hydrolazine is a direct vasodilator and its mechanism of action is not known. So CCB cannot tell. It also reduces nitrate tolerance. Now psychiatric questions. 24-year-old college dropout was referred to the inpatient psychiatry unit due to severe social withdrawal. Following the death of his father a year back, he felt isolated, and around the same period he started playing computer games for almost 10 to 12 hours per day. When not gaming, he becomes irritable, vindictive and verbally aggressive. Which of the following is true regarding the condition? First, it exhibits somatization, anxiety and sleep disturbance in the absence of depressive symptoms. Second, WHO has classified gaming addiction as a mental health disorder in International Classification of Disease 10. Then for its diagnosis, a behavioral pattern must be sufficient severity to result in significant impairment for at least 12 months. Then gaming behavior are not seen as specific forms of maladaptive self-regulatory strategies in youths with attachment issues. Very big answers are there. So I will repeat first. See, 23-year-old is there. His father died, and then he was indulged in gaming, and that too for 10 to 12 hours each day. And when not gaming, he becomes irritable, vindictive and verbally aggressive. Which of the following is true? So it's difficult for me to repeat again all the. So the answer here, it is which of the following is true is for his diagnosis B. B is not right. C is the right one. Okay, for his diagnosis, a behavioral pattern must be sufficient severity to result in significant impairment for at least 12 months. So when diagnosis is, the answer they have given is C. So you cannot tell this. Next, a very easy question. Fimbrectomy is also known as Pomeroy's technique, Pustida's procedure, Kroener's procedure, or Irwin's procedure. So this I think anyone can answer if you know. Then again I will repeat. Fimbrectomy is also known as Pomeroy's technique, Pustida's procedure, Kroener's procedure, or Irwin's procedure. So I want to answer this. Can anyone tell? It's easy actually. I think it's factual only. Okay, no one knows that, I think. So the answer here is fimbrectomy is also known as Kroener's procedure. See, what happens in Kroener's procedure I will tell you. See, this procedure involves a ligation of the distal ampulla. Distal ampulla is ligated on the tube only, with two permanent sutures. Then dissection of the infundibulum of the tube is done. So basically, fimbrectomy, also known as Kroener's procedure, and it involves ligation of the distal ampulla with two permanent sutures. That's it. And then we dissect the cut from the infundibulum. So can anyone tell me why we use fimbrectomy? Okay, next question what we have is, hello? What are you showing? Basically I am discussing the MCQs, random MCQs basically for NEET PG. So next question what we have is, what is the ratio of type 1 to type 3 collagen in the adult human skin? It's a factual question again, but you have to learn that. I will repeat again. What is the ratio of type 1 to type 3 collagen in the adult human skin? 1:4, 8:1, 3:2 and 4:1. So you have to tell. I know it will be difficult, but if you know you can tell that. Okay. See, the answer is 8:1. It's a factual, but you have to remember this. The ratio of type 1 to type 2 collagen in the adult human is 8:1. Now I will tell you something. See, type 1 collagen is predominantly collagen in the human dermis, whereas type 3 is predominant in this human skin during embryonic condition. 3:1. No, not 3:2. 3:1 is not the question only. It is 8:1. Okay. So basically 8:1 is the answer. Okay. Now emergency question. A 10-year-old boy was brought by his mother to the ER after having a sudden episode of vomiting of blood. On examination, splenomegaly is detected and with engorged superficial veins around the umbilicus, which is the investigation of choice of this patient. So what you know here is first 10-year-old boy. Second, he comes with vomiting of blood. Third, he has splenomegaly with superficial veins around the umbilicus. You are receiving comments late. I cannot help. So then, which of the investigation of choice in this patient? Abdominal USG, capsule endoscopy, triphasic CT, upper GI endoscopy. So basically, you know, patient is 10-year-old, sudden episode of vomiting of blood, splenomegaly, engorged superficial vein around his umbilicus. So portal hypertension, yeah, you can tell portal hypertension. See, but what is the investigation choice I want here? See, abdominal USG, capsule endoscopy, triphasic CT, upper GI endoscopy. So what is the investigation choice you would do here? Anyone wants to answer? I will wait. Comments are coming late, so that's why. So you are right, it is a case of portal hypertension, which will be axial bleeding has occurred here. So the investigation of choice here is upper GI endoscopy. Okay. But can you tell me the treatment of we will do upper GI endoscopy, that is the investigation, but what will we treat? Because with the upper GI endoscopy only we can treat the patient. Upper GI, yeah. It's coming late. Okay, you can treat this patient by having a band ligation and sclerotherapy. Basically, you will do upper GI endoscopy, and in that only you can do band ligation or sclerotherapy with that. Capsule endoscopy and all that we don't do generally. It is also expensive, but yeah, you can do. Now it's question of ophthalmology. See, you are studying the histological anatomy of the lens. You are measuring the thickness of the lens capsule in various areas. At which of the following zones would you get the lowest measurement? Anterior pole, posterior pole, pre-equator region, at equator. So, yeah. Thickness of the lens capsule in various areas you are measuring. So, at which of the following zones would you get the lowest measurement? Anterior, posterior, pre-equator, or equator? This you should know. Astros and all. Okay, the answer is, anyone wants to tell first? I'll wait. See, the lens capsule is thinnest at the posterior pole and it is thickest at the pre-equator region. So this you have to remember. Thinnest at the posterior pole and thickest at the pre-equator region. Pre-equator, that is the pre-equator is not the answer because it is not the thinnest. Pre-equator is the thickest zone. Hello? Then, as a CHC medical officer, you organize an outreach program for HPV vaccination and the prevention of cervical cancer. Which protein is used for antigenic response of this vaccine? Basically, you are giving an HPV vaccination, and which protein is used for antigenic response for this vaccine? Your voice isn't clear. Okay. It is audible right now? Okay, I'll repeat the question. As a CHC medical officer, you organize an outreach program for HPV vaccination and the prevention of cervical cancer. Which protein is used for antigenic response in this vaccine? So we have ECH, E7, then L1, E1, E2, then L2. So which protein is used for antigenic response of this HPV vaccine? ECH, E7, L1, E1, A2 or A2? L1, yeah, L1 is the right answer. See, basically HPV vaccines consist of HPV L1 major capsid proteins. So in this also you have to remember. Then the question is BIRATS. BIRATS is used for reporting all of the following except the options are mammogram, breast MRI, breast USG and thyroid biopsy. So BIRATS is used for reporting all of the following except mammogram, breast MRI, breast USG and thyroid biopsy. Am I audible? So this question is also the last one as well. With the breast imaging, the answer here is thyroid biopsy. BIRATS is used for reporting all of the following except thyroid biopsy. So what we are using, mammogram we will use, breast MRI we will use, breast USG we will use. So all breast images should be reported by BIRATS. What is BIRATS? Thyroid, yeah, thyroid is the right answer. See, BIRATS is basically breast imaging reporting and data system. So we have a full scoring system of that category 0 to 6. You are audible, just side disturbance. Yeah, it happens. So I finished this talk today because questions are over. It was not 25 but I think it is 20 questions. Mostly they were image based, so it was, we cannot discuss that. Thank you.